Hi, my name is Mohammed, and today I'll be talking about the INA 2010 application of EHR in healthcare. So there are multiple problems in healthcare, such as rising expenditures, inconsistent qualities, and gaps in healthcare and access. A solution to those problems is electronic health records. An EHR is a collection of electronic health information about individual patients or populations and is capable of being shared across different healthcare settings by embedded in network connected enterprise wide information systems. This is important because EHR systems increase physician efficiency and reduce costs as well as promote evidence based medicine.
After I read about article of this week, I have some interesting thought. For the current application of EHR in the healthcare field, there are some advantages and also followed with some risks. So for the advantages, EHR's features and interfaces that are very appropriate for one medical specialty. EHR also provides the way for administrator to get the data for the billing and the data for the patient. And also the physician could see the effectiveness of the treatment. This is also good for long-term preservation and also could storage the record for the future use and even to predict some future illness for the users. Also, there are some disadvantages. However, the data protection and user privacy is a serious problem that we need to solve because based on the big data technology, the privacy is always a very serious problem for the use.
So EHRs definitely have a tremendous capability to really change healthcare as we know it, and having the access to data across healthcare providers and labs and whoever could potentially use it could really revolutionize healthcare that people could potentially receive. However, the issue with having that much data in one place, as with any source of data, is that you have the risks for privacy and security breaches. And the difference between an EHR data breach versus a data breach of anywhere else is that healthcare data is much more personal and it's much more dangerous if that data is leaked. If your Facebook data that gets leaked, it's like, oh cool, my your birthday got leaked. Obviously it's bigger than that. There's a lot more data there, but it's not like people are gonna know that, oh, you have this disease or you have this medical condition, and oh, I know you're dying, so maybe you have cancer, you're gonna die in a few weeks, and the potential harm that could come from people getting that data is is way more than it is with any sort of social media information. So one thing that would help prevent that, and that would have to be put into place before any sort of inter-organizational EHR could be put in place, we would have standards set in place and to have a regulatory body that could ensure that when data is being shared across organizations, that the appropriate and required security measures are being upheld in order to secure patient data.
There are a few trends of the EHR development, such as technical, business, and its future vision. Technical trends include ontologies and semantics. Ontologies are sets of concepts or categories in a subject area or domain that shows their properties and the relations between them. Semantics refers to the branch of linguistics and logic concerned with meaning. According to the assessment, the maturity of the semantic web will be led by the expanded use of extensible market language and resource description framework standards. These standards will allow queries that yield richer and more relevant search results. Majority of the semantic web will require the emergence of an integrated framework of ontology tools that are capable of translating their output into non-native executable forms, which is necessary to support the use of web services. Business trends include three information revolutions: initiation, acquisition, and consolidation.
The second article from this week's readings headlines the topic of how computerized provider order entry systems are improving but still do not hit the goals the systems were originally intended for. According to a Castlight Health analysis of data and a Leapfrog Group's National Hospital Survey from 2015, these CPO systems failed to send alerts for 39% of potentially harmful drug orders, in addition to 13% of potentially fatal medication orders. These numbers show only a small improvement over the previous year, but progress has generally plateaued in the last 5 years. So, in an attempt to lower the rate of these systems failing, the Leapfrog group encouraged hospitals to recheck orders before processing them and to do direct collaboration with their health IT providers and clinical leaders to reduce potential points of error wherever possible. There are some downsides to this, such as causing alert fatigue, but overall, this proposition was a success. 96% of all US hospitals now meet leapfrog standards for CPO implementation, which is a massive improvement over the 2% mark that the hospitals hit back in 2001. I think it's great to see so many hospitals adopting CPO systems. Now, even if the failure rate is high initially, over time these hospitals do get used to the system and they're able to fix a lot of the issues that they have so that the failure rates eventually will